Thank you for the introduction. Dear audience, allow me to present the case of a 40-year-old male patient with a negative medical history. In 2021, he was hospitalized with acute pancreatitis. Abdominal ultrasound revealed edematous pancreatitis and diffuse hepatic lesions. Significant dyslipidemia and slightly elevated gamma GT levels were shown in the laboratory findings. Alcohol consumption was suspected as the underlying cause of pancreatitis. In line with the recommendation of the lipidologist, fenofibrate therapy, Mediterranean diet, and alcohol abstinence were initiated. But despite of this therapy, there were no significant changes in the laboratory findings. To prevent another episode of pancreatitis, plasmapheresis was also performed. A few months later, he was hospitalized again with fluctuating illness characterized by nausea, headache, slurred speech, drowsiness, and altered behavior. And beside these symptoms, hepatitis syndrome revealed. So at this point, he was referred to our clinic for further investigation. At our hepatology outpatient clinic, we exclude toxic agents. Total abstinence was confirmed by the patient's wife. And hepatotropic viral serology, autoimmune serology, and tumor markers were both negative. Wilson disease and hemochromatosis ruled out as well. We performed a liver elastography, which revealed an F3 fibrosis without sign of steatosis. So at this point, we performed a liver core biopsy also, and which manifests a picture of alcoholic liver disease. Based on the clinical presentation, the laboratory findings, and the histopathological findings, the possible diagnosis was autobrewery syndrome. So to confirm our diagnosis, we perform a carbohydrate challenge test. On 4 consecutive days after loading with glucose, protein, starch, and white flour, we measured the serum and exhaled alcohol levels at fixed intervals. During the test, higher exhaled alcohol values were detected only during the white flour test. Additionally, according to the patients regularly the patient's dietary and breathalyzer log, slightly higher alcohol values appeared as a result of prolonged fasting and periods of stress. Beside the carbohydrate test, we also performed the stool microbiome test, which revealed the overgrowth of bacterial families capable of alcoholic fermentation. So regarding the treatment options, there is no agreement how to treat autobrewery syndrome. One option is a high protein and low carbohydrate diet and probiotics, also the avoidance of provoking factors such as stress, prolonged fasting, and alcohol consumption. Another option is the eradication with targeted agents based on the histological or microbiome samples. There are some studies with successful, which present successful cases after fecal transplantation, and maybe in the future there will be the microbiome therapy which can cure this disease. We choose the first one, so maintaining a strict diet. After 6 months, we find a normalization of the laboratory findings, and the fibroscan revealed the huge regression in the cirrhosis to F1. In summary, autobrewery syndrome is a disease of ethanol intoxication as a result of endogenous fermentation by fungi or bacteria. The clinical picture is characterized by complaints of continuous drunkenness and hangovers. Long-term organ damage is a consequence of endogenous alcohol exposure. And in our case, with the help of the strict diet and regularly monitoring alcohol levels, significant reduction were observed in the patient's complaints, laboratory alterations, and liver fibrosis. Thank you for your attention.
I have to say that it's quite something. Please remember auto-brewer syndrome next time you're stopped by police. I also believe that it's difficult to get a hangover if you're constantly drunk, but that's my Polish experience, actually. We have our expert toxicologist, Dr. Professor Dan Perry.
Thank you. Excellent presentation. First question to you, and then I have a little bit of commentary, is were you considering doing anything to look at whether he'd had needed his biome changed at all? Like, was he at risk factors for that with multiple antibiotic use? Any reason, short gut syndrome, anything else in his history suggest the cause?
Yes, we did, but we couldn't find anything. So
Okay.
we performed colonoscopy and gastroscopy and everything else which we found in the history.
Okay, and he didn't have multiple courses of antibiotics leading
No.
up to his presentation. Right. The interesting thing with this disease, and I'll come back to a comment you mentioned, Professor Jessica, is that oftentimes it's sort of gets unmasked at the time someone has a diagnosis of diabetes. So that's the high sugar content in a lot of these cases. But typically the story would be bacterial or sometimes fungal overgrowth. There's an interesting case, medical legal case that I was involved with to the extent of drunk driving charges. So it has been sort of used as a potential, it's a real phenomenon. So these patients don't intend to be drunk, and they weren't drinking when they were driving, but they are drunk legally when they're driving. And so the defense has been used. It's worked a couple of times, but realistically speaking, those patients do need sort of therapy and make sure that they're not. So breathalyzers is the way to go for them before they do drive. You can get this interesting, there's folks that just get the bacterial colonization issues in their bladder. So you can actually get auto-brewer syndrome in just your urine, which doesn't give you the alcoholism and everything else. And you wouldn't know that unless you're testing urine for alcohol for whatever reasons. But I do think this is an interesting disease to know about, especially with someone who has other features of alcoholic disease and adamantly denies any social history. We don't look for it enough. And so thank you for bringing this case to our attention.
And the level could be high, actually. The alcohol level could be indicating intoxications.
Sorry,
The level of alcohol,
Yeah.
when measured in blood, could indicate intoxication under legal parameters.
yes.
Yeah. 10 times.
Yeah.
That is impressive. But you can always claim that your microbiome in gut changed in the meantime. That's why you don't have it now. Any other questions? Dr. Preptani.
Sorry, I couldn't hear.
Sorry. Yeah, great presentation. A couple of questions. What was the initial lipase, and was there a glucose level done, number one? And number two, one of the mainstays of therapy for acute pancreatitis due to hypertriglyceridemia is insulin, intravenous insulin. And I'm not sure if I missed it, but was there a reason why insulin was not given?
Sorry, what?
So
Don't
was there a reason,
understand.
so
Very
was there a lipase level done? Was there a glucose level done? And was there a reason why intravenous insulin was not used for the hypertriglyceridemia causing the acute pancreatitis?
The glucose level was normal. That's why I didn't mention it. And why?
Lipase?
Lipase.
Lipase, sorry.
Lipase was elevated also, so of course, but yeah, I skipped this part of because
Sure.
I said that the diagnosis, so I thought it will be
Of
very
course.
clear. But yeah, it was not very much, but I think it was below 1,000.
And the reason intravenous insulin was not used?
I don't really know what was the treatment of the acute pancreatitis, because it was in another department. And
Sure. And I just wanted to make one more comment. We're seeing several cases now where patients who are on SGLT2 inhibitors, they're getting falsely, well, actually they're real, we're seeing positive alcohol levels in the urine. Because when you have glucose, it's a nidus for fermentation of alcohol. So there's been patients who are totally normal, and they've actually lost their licenses because a emerge doc sends a urinalysis, because it's a medical legal case, where the patient wasn't drinking, but the SGLT2 inhibitor caused a positive alcohol level in the urine. So something to be aware of for internal medicine and for emergency physicians and for people at large. So we have to really take a history and sometimes defend our patients, because they can be wrongly taken away their licenses.
Well, we keep learning whole life. Thank you very much.
Thank you.
Thank you.
Thank you.